Hi all, welcome to EZI Nurse. So here we are going to definitely discuss about some important questions that is coming in your examination. I am ready, hope you are with me, and we are going to definitely write and crack this exam. So we are discussing about applied nutrition and dietetics. So some important questions that we are going to deal with. The first question is, the first question is about breastfeeding. What is this breastfeeding? All of us are human beings and we definitely know about this. So coming to the breastfeeding offers numerous benefits, that is for the mother as well as the baby. So here you can see there are some advantages as well as there is some of the disadvantages that is there in breastfeeding. So here you can see what are the benefits of breastfeeding. So for the babies, they will have some optimal nutrition, that is there is some positive nutrition. Immune system will be boost up. Then coming to the cognitive development, the brain development will be in a very good sense. Coming to reduce risk of allergies and chronic conditions. So definitely they will not have much fever, cold, flu will not suddenly enter into their body. Bonding and emotional well-being. There will be a rapport between the mother as well as the baby. There will be a creation of bonding that will definitely go from the life till death. Then for the mother, what are the things that is going to definitely help them? Postpartum weight loss. So there will be a weight loss that will be happening. Reduce risk of postpartum depression. So the depression state will be reducing. Lowered risk of breast and ovarian cancer. Delayed return of fertility, cost effective and convenient. So that is a convenient method wherein they will have a very good bonding between the mother and the baby. So here you can write in your own words but be into the topic. Do not go away from the topic when you are writing your exam. So next, here you can see again in detail. So whenever you are writing your exam, give some detailed explanation about each point that you are giving. So in that way you can definitely score the marks that will be definitely given by your examiner. So if you are not writing, then it will be helpless. So coming to the next. So here are some of the guidelines for meal during lactation. So during lactation, there will be certain procedures that must be or certain meals that they have to be creating. So increase calorie intake. So the mother is definitely feeding the baby. So what is happening? So lactating mothers need approximately 500 extra calories to meet their breastfeeding. So for the it should be transferred to the baby. So definitely the mother should intake good sufficient amount of nutrients, then only it can be transferred to the baby. Then balanced diet. A well-balanced diet should be maintained not only within the mother and the baby, it should be maintained by all the human beings to have a appropriateness in their life. It should be disciplined manner. So when we are having a disciplined manner, definitely our routine of meal taking also should be in a proper balanced diet. So the minerals, essential of vitamins, that and all must be taken. Then coming to the hydration. The mother and the baby must be well hydrated. Then only the lactation process will be happening in a proper manner. Then here you can see the next question. What is this malnutrition? Coming to the malnutrition, here you can see the picture wherein the baby will be very skinny. So what is this malnutrition? Malnutrition is referring to the deficiency, or sometimes it is due to the excess or imbalance in a person's intake of energy. So this is what is about the malnutrition, and it is encompassing of both the things. What are they? That is the undernutrition, that is lack of adequate nutrition, and sometimes overnutrition. So these are the two components that is merging and making your one definition mark. That is your definition of malnutrition. When you're combining both these components, when your key points are very strong, definitely you're going to crack your examination of definition. Coming to the types of malnutrition, what are the different types? Here you can see protein energy malnutrition and you can see micronutrient deficiency. So these are the two. Explain in detail whenever you're writing. At least give one sentences whenever you're writing your answers in the examination point of view, so that the examiner will understand that you know something about this topic. So, PEM, it is a condition wherein it is causing marasmus to the children, especially it is affecting the children. Next stage is the micronutrient, wherein there is lack of nutrients, vitamins and the minerals. So, they are lacking iron, vitamin A and iodine. So, these substances are lacking. So, this is a small overview about malnutrition, and this is a definite question that were repeated in each sections, in each modules of your paper. So, definitely please do write this answer, by heart this answer. So, definitely you are going to score the mark. So here you can explain, so you can write in a mind map format and show them what is the causes of malnutrition, what are the risk group, who and all are getting affected. So the infants, young children, pregnant and lactating mothers, elderly mothers who are having low income. So whenever the people are not able to afford these things, they are also under the risk group. What are the causes? Why is it happening? Please do explain. Then, what is the role of community health nursing in the malnutrition? What are the steps we are taking? So, we are trying to analyze, we are trying to assess the thing, we are trying to identify the case, we are educating the patients, what you have to take, what you should not take, why it should be excess, why it should not be excess. Then, coming to the interventions and advocacy. So, you are promoting the policies that the ensuring about the food security. So, in case of any food security that can be avoided. So, in this manner, role of community nurse is being done. Then, prevention strategies. What are the strategies that we are taking to promote and prevent this disease? That is public health programs, breastfeeding promotion, community-based nutrition programs are being conducted in each state or each village that is being done. Then, management of malnutrition. How are you going to manage the malnutrition? So, there are nutritional rehabilitation centers wherein they are providing food, then follow up. So, you're definitely, once you're going to a home visit, if there is a marasmus patient, you will tell what is the diet chart they have to follow, what and all must be followed, what should be taken, what should not be taken again. Then, referral system. So, these are the ways that you are managing the malnutrition. So, this is about malnutrition. Third question is, what is this nutrition? That's a simple and basic definition. So, here you can see, nutrition is the process by which the organism is obtaining, assimilating and utilizing nutrition from the food to sustain life, to promote growth and maintain health. So, children, I can help you with this definition part. How you can do is, make it simplified is, from this nutrition until health. By heart it for 5 or 10 times so that you are getting thorough with that proper definition. Next, from that it till the functions, you are going to learn it. So, in this way, you can by heart it if you are a by hearter. If you are understanding the topic, definitely in that manner is also very good, so that you can write this whole definition without any burden. So, in that, nutrition is a process by which the organism is obtaining, assimilating and they are utilizing the nutrients from the food for sustaining life. So that we are sustaining our life because of intaking all these kinds of nutrients, and it is involving the intake of macronutrients, carbohydrates, proteins and fats, and micronutrients are also there, that is vitamins and minerals. So in this way, the whole nutrition definition is structured in a beautiful manner. Coming to the nutritional problems in India, this is also a proper 5 markers or 10 markers that is definitely coming for your exam. Please do note this and learn this in a proper manner, in a proper structure format. Write it in appointments or write it in a mind map form so that the evaluator is also impressed. The nutritional problems in India. So what are the problems that they are facing? So there is undernutrition. So in undernutrition, again it is being classified. So that is protein energy malnutrition. Next, you can see micronutrition deficiency. Under this micronutrient deficiency, there is again iron deficiency, anemia, vitamin A deficiency, vitamin D deficiency. So, if you are going to write all these 3 points, and at least if you are not remembering the explanation, write the key points. Definitely, you are going to get 2 marks or 1.5 marks is definitely guaranteed for you. Next, Here you can see overnutrition and non-communicable disease. Under this, again there are some subtopics, that is obesity and overweight, diet-related NCDs, that is non-communicable disease. Third point is nutrition-related health issues. So again, coming to nutrition-related health issues, what are they? Stunning is there, then wasting is there, underweight is there. So here you can see what is this non-communicable disease. So that is a cardiovascular disease wherein sometimes it can lead to diabetes, then chronic respiratory disease, cancer. So these are the some kinds of non-communicable disease that can be sometimes not cured much than the communicable diseases. Here you can see overweight, overeating also. So these are the some kinds of things that you can see in overnutrition and non-communicable diseases. So under nutrition. So next you can see what are the causes of nutritional problems in India. What is making them to become having all these kinds of nutritional problems. So the first point is the poverty and food insecurity. So that there is some limited amount of foods and the people cannot sometimes afford the nutritious food that they must have to intake. So that's the main problem. So poverty and insecurity. Next, here you can see poor dietary practices. Why? Because there is lack of awareness, sometimes dietary restrictions, sometimes they are having this sufficient intaking of the food. So in this manner, they are unable to have these kinds of nutritious or vitamins or minerals into their body. So definitely poor dietary practices is happening. Then inadequate health services. So what is this? Limited access of healthcare. Sanitation is not in a proper manner. Then clean drinking water is not available. So in clean drinking water, sometimes people are spitting. So the germs is getting directed from one person to the other person. The one person is drinking, the same person will be drinking the same water. Definitely there's a communicable disease happening. So in this manner, inadequate health services is given to the people. Then lifestyle changes. Lifestyle changes is one particular thing that is definitely happening and is shifting towards high calorie processed food, especially in urban cities. So here you can see we are all the fans of burgers, pizzas. So these are the items that we are craving definitely. So these lifestyle changes are definitely happening. What are the benefits that we are getting from this pizza, burger, all this stuff? Nothing. We are getting useless. But if you are having a proper diet of having this good nutritious food like fruits, vegetable, iron-rich fruit, vitamins where we are getting in this manner, if you are going, then no problem. But definitely we are running behind of pizzas, burgers. Definitely there is a lifestyle modification changes. Next, coming to the environmental factors. What are these environmental factors? The environmental factors are crop failure, natural disaster, regional iodine deficiency in soil. So these are the normal things that is happening, and lack of all this materials stuff, then definitely we are not going to able to have this kinds of nutritious food. So whenever in case of farmers what they are facing nowadays, they are requested or they are forced to have all these kinds of pesticides, insecticides, so that they are free from all those things. But we again are having all these kinds of poisonous food, again no nutrition, no vitamins. So in this way, the lot of problems. So when we are discussing, we'll have lot of things. I know these things will be hindering in your mind too, but definitely in your exam you have to write this so that we are going to get our marks. Then what is this role of community health in nursing prevention? So there is assessment and screening procedure, education and counseling must be done, community mobilization, and coming to the referral. So these are the some kinds of role that must be taken by the nurse for getting prevented. So next we are coming to hyperkalemia. So what's this hyperkalemia? Hyperkalemia is a kind of medical condition wherein you are characterized by a abnormal high level of potassium. So here is your main thing that you have to keep in your mind whenever hyperkalemia. Kalemia is a term so that it is coming to potassium. So when there is an increase hike in the potassium level in the blood, the hyperkalemia is definitely going to happen. So what is this normal potassium level that is being taken? So the normal ranging is from 3.5 to 5.0. This also must be remembered. So if you write your main important key points you're definitely going to write and you're getting your marks. So this is about hyperkalemia. Then you can list down what are the causes, what are the symptoms, what are the diagnosis, what are the management. So when you're going to explain all this, definitely, as you know that you're getting your marks. Then what is this scurvy? So here is your proper definition for that. Scurvy is a disease. It is resulting from the deficiency of vitamin C. So here is again your key point, that is your vitamin C, wherein ascorbic acid is very less, which is essential for the synthesis of collagen and certain neurotransmitters and plays a very role in wound healing process and immune function. So sometimes when you get a cut or a wound, when you're not having vitamin C, definitely it's not going to heal. So when you're having vitamin C, then the scurvy is not going to come. Vitamin C is now there, definitely scurvy is going to come. So scurvy symptoms, what are they? Bleeding of skin and mucus, fatigue, depression, increased susceptibility to infections, muscle weakness. Symptoms, what are the symptoms of overdose? So there will be nausea, stomach cramps, diarrhea. Next, here you can see some of the list down this things, that is bleeding of skin, mucus, gingivitis, loose teeth, rough, dry skin, joint and body ache. So these are the symptoms that, so you can write it in a diagrammatic format so that the examiner is going to get impressed. So next, let's quickly move on. What are the energy value of nutrients? So some of the energy value of nutrients, it's the amount of energy that the nutrient is supplied to the body. So SI unit, what we calculate it is in a joule format. What are the energy, how it is, kilojoules also it is maintained, and so 1 calorie is 4000 joule and 4 kilojoules. So this is the thing. So energy value of nutrients. In that, you know, we have definitely will go through each one of that energy nutrients. We have to have our nutritious food like banana, apple, nuts, all the grainy items, the green leafy vegetables, spinach, all those things make us giving our energy nutrient to our body. So what are the next thing? Don't get confused. This is the next question. What is the source of dietary fiber? Dietary fiber. So we can list it down in different steps, or you can have a chart wherein you can understand. So here you can see legumes, grains, fruits, vegetable and insoluble fibers. So in that you can see whole wheat, bran, then nuts, seeds, berries. So here you can see definitely, so that you will have a clear idea what is the source of dietary fibers. So when you're taking more of dietary fibers, definitely there will be proper digestion, there will not be any constipation, you will have a proper healthy lifestyle. So this is sources of dietary fibers. So remember in your exam, coming to the sources of dietary fibers, think of about this diagrammatic chart that you have seen in EZI Nurse and you are going to write in the exam. Next, what are these sources of vitamin C? What are they? So here again you're having some of the points, vitamin C and health. There are some health risks from excessive vitamin C. What are they? Vitamin C has low toxicity. So here you can see there is a low toxicity and is not believed to cause serious adverse effect at high times. The most common complaints are, so here is your first point, diarrhea, nausea, abdominal cramps and other gastrointestinal disturbances. So this is vitamin C, and what are the excessive vitamin C, what can cause into your body. Then what are the best source of vitamin C? Here you can see green bell peppers, that is known as your capsicum, okay. Then coming to guava, then strawberry, then you're having beef spleen, then lime, papaya. So different fruits and vegetables and green leafy vegetables are there to have a very healthy vitamin C boy and girl, okay. So these are giving foods that is the source of vitamin C. And this comes our end of the session, and hope you have understood the session. We'll meet again, and please guys, all the best for your exam, and you are going to definitely crack this. Thank you all, and signing off.